the big question of the day becomes, Doc, how can I have more volume when I explode? And I get this question every now and then. But now I've noticed that the question has come through twice. So I wanted to spend a little time talking to you about that, okay? Because at the end of the day, there are some supplements that you can use to increase ejaculate. But I want to be clear that when it comes to, this explosion at the end, there are a lot of parts to this process. So the first thing that I want you to do is, in order to explode and have more volume, you've got to have more volume in your body, so you cannot be dehydrated. So this is why drinking your water, increasing your fluids is important. And the flip side of that, if you are a drinker, I need you to know that every time you have 2 or 3 cocktails, or even 1, your body releases something called antidiuretic hormone, which is a DH, which basically is causing a dehydration in your body. So if you're drinking or you're a drinker, you've got to know that on those days, you could potentially have less volume there available, because your body is going to be naturally a little bit more dehydrated. So replenish your fluids and make sure you're getting enough fluids. So that's one thing. The other thing is, and I've talked about this in another video. So if you want to go and see the video on maca root, I want you to check that out, because I want you to know that maca root is amazing across the board for a lot of different things for a lot of different people, men and women both combined, and maca root is actually a key ingredient in the Manding smoothie. And which is why, of course, I call it the Man Bingo smoothie, because it actually has maca root in it. Those of you who know who Manding is, you understand the play on words there. But they conducted a small study where they did a 4-month oral treatment of tablets of maca root. And what they were doing is they were analyzing the seminal fluid. So seminal fluid is the same as semen. It's made by the seminal vesicles which sit behind the bladder and kind of above your prostate, right? And so the guys in the study were between the ages of 22 and 44 years old. The ones in the group that were treated with maca actually not only had an increased volume, but they also had increased in sperm count. Their sperm was more mobile, moving around more. They had more sperm available. So not only is it useful when it comes to fertility for guys, but it also can increase the volume of ejaculate that's there. So that would be kind of taking a look at the Man Bingo smoothie. And maybe what I'll do is, since that's my favorite smoothie and I like to talk about it a lot for obvious reasons, and guys have great results with this one, I'll actually do a video where I'm making this Man Bingo smoothie, so you can see what's in it. It can bring the funk. But I want you to know that when we're talking about maca root, we're talking about a long-term thing. You want to be taking maca root regularly for 3 or 4 months before you would see this type of evolution. So I think oftentimes too when it comes to erectile function, I think that we give up too quickly and say, oh, okay, I bought this, I saw this ad and I got this, and that didn't work, okay. So then I saw another ad and then there was a Dr. Berg and then there was a Dr. Ross, and then there was a Dr. such and such. So you look up and you get all this stuff and you don't know what to do with it. Right. So, I always tell my patients and my guys, let's give something a 90-day trial, unless it's an allergic reaction, or unless something is getting worse, and then we can step back and say, did we have any results from it? But you've got to let it kind of get in the system before you say, it didn't work. So I also too, what I'll do at the end, I'll go back into the video and drop some links for studies. So you can actually read some of these studies on your own because some of you are just the scientific and want to know more about it, right? So the other thing that you can do to increase volume, it's really kind of improving your prostate health. And so I want to show you here just to remind you, we can never know enough about our bodies, right? And so on the left side, you notice this is a normal prostate. So the prostate is sitting kind of right here, and on the right side, I have an enlarged prostate. So what we're looking at here is a cutaway of the body. So it's as if they took a cadaver or, like a model, and kind of just saw you right down in the middle, and then laid it on the side and took a picture. And what we're looking at the top is the bladder, and then that pink part underneath where I've just circled, that's the prostate. On the left is the small one, and on the right is the enlarged one. And then what you'll notice there's some blue arrows, right? So the blue arrows represent the course that pee or urine would go through the urethra, right? like right there. And then on the enlarged prostate, you notice the urine has a hard time pushing through here because of why? Because the prostate is enlarged and has clamped down on the urethra, or that tube that the urine is supposed to come through, right? So when we're looking at an enlarged prostate, I also want you to let me erase this. So you don't have to look at my jagged lines. I also want you to look right behind the prostate here, right where you see my yellow arrow. That is actually your anus. Now, when we're talking about prostate massage, we're talking about either the one that's going into the anus, or the one that's focusing on the perineum right here, where we can pass vibrations through right through here, or we can pass vibrations through right behind the prostate. And now I want to show you what is responsible for the majority of the fluid that's supposed to come out. See right here, let me put my pen on again right here, right here. This is the seminal vesicle. Now that seminal vesicle sits behind the bladder, but above the prostate. So if our prostate starts to get enlarged, you can see now why it is that the volume of the semen actually starts to decrease because of two reasons. Right, when you look here, that semen has to go through here. But what if it's blocked, or what if you've had some type of surgical procedure or some type of procedure where they burn the prostate or whatever? And now guess what? That area could be completely blocked, and maybe no prostate, no fluid can get through. So you want the fluid to get there. The prostate makes fluid and all of that, and it's all going out the same tube, which is the urethra, the same tube that urine is supposed to get out. So when it's enlarged, you can have trouble not just with delivery of the semen, but you can actually have trouble with making the semen, because now this prostate is enlarged, and it's interfering with the seminal vesicle's job, right? So getting back to the concept of a prostate massage, this is the anus right here. And so everybody gives me a hard time about the prostate massage, but the data is there, and I have plenty of patients who will attest that the prostate massage changed their life, right? So the prostate is right here. And so you can imagine if you can massage right here, that you actually can potentially unblock this duct here. You can potentially stimulate that seminal vesicle, and you can potentially help reinfuse some health into the prostate. Because now the prostate has to go, like a rubber band to shoot that out. But if it's enlarged, then it's much harder for it to do its job as a rubber band. Okay. Now, then this picture I want to show you here demonstrates. Now what you're looking at here is the same thing. It's like a cutaway. But if you look at where this prostate massager is placed right here, it can stimulate the seminal vesicle on the back. It can stimulate these ducts because keep in mind, this is just half of the body. So we've got this happening on both sides of the body. We got a seminal vesicle on the left. We got a seminal vesicle on the right, and we've got two pipes or ductwork that's supposed to go through, meet in the middle, and then shoot down and out. So as you can imagine over time too, though, those pipes or those ducts can actually really start to get clogged up. And that's ultimately one of the reasons why when your prostate starts to get enlarged, you got less semen coming out. And sometimes you have trouble even getting any semen out because these areas may actually be blocked, right? So like for instance, with the Ultimate Stiffness Bundle, the guys who order the printed copy, I personally enclose a prostate massager and some rings because I feel like every guy needs these because it can change their lives. I mean, I have at least 2 guys I can think of off the top of my head that came to see me, and really on the first or second day of treatment, I put the prostate probe in and leave the room for it to vibrate, and then get messages the next day of like, "Doc, I don't know what that thing did, but something because I woke up with an erection." I mean honestly, passing vibrations through that prostate, like there really makes a difference. And I mean, if you think about it, it makes sense, right? Because like if you have a stiff muscle, right? And it's stiff and it's giving you trouble, you put a little heat on it, put a little vibrating rubber on it. You go into the store, sometimes they have those chairs and you sit in it good. I mean, there's a lot of data about vibration and how it can help regenerate nerve tissue nerves, but also stimulate sexual activity. I've been sampling different male vibrating objects to really figure out what's the best way to bring that to you guys in a way that you're not eked out by the process. But also you feel comfortable and confident with the vibration process, because vibration for regeneration, it's just an amazing, untapped thing. So, And we see it when we're using vibrations to help with the prostate. We see it when we're using vibrations to help a lot with literal activity. And we see vibrations a lot when we're using it to help gentlemen who have extensive nerve damage to the point where maybe they're paraplegic. We actually use vibration to help as a reflex for ejaculation, right? So say we have a gentleman who's been in a really bad car accident or has been shot and really can't move from the waist down and wants to get his partner pregnant. Well, we use vibration as a way for him to get the erection and to ejaculate, and it works. So why aren't we using that more and more with gentlemen when it comes to ed and just augmenting and retraining the process? So in Asian countries, particularly in China, they have trainers that are designed just for that, you know. They are very much in tune with this process of regenerating erectile function. So they do that a lot more there. But it's time that we have alternatives to just Viagra. And then when Viagra is gone, then you got someone trying to sell you a surgery. And then it's a whole thing like, what can we be doing in this process, and through this trajectory of life, that can help you stay, virile and feeling like, if the opportunity presents itself, I can have a great sexual experience.